I want to start today's session with a question that I hear whispered in my exam room, often with a lot of shame and confusion attached to it. A patient will look at me and say, "Doctor, I think it's gone. I think my clitoris has disappeared." Or they might say, "I can't find it anymore, and when I try to touch where it used to be, I feel nothing, or I feel pain." If you are watching this and nodding your head, I want you to take a deep breath. You are not crazy. You are not broken. And most importantly, your clitoris has not vanished into thin air. However, it may be hiding. Today, we are going to tackle a topic that is almost never discussed in standard education: clitoral atrophy and phimosis. We are going to answer the question, does the clitoris actually shrink? We are going to learn how to locate anatomy that may have become buried under tissue, and most importantly, I'm going to teach you the specific techniques to bring it back to life and restore sensation. Welcome, I'm Dr. Emma. Too often, the health needs of women over 50 are ignored or misunderstood. Not here. I have dedicated 15 years to researching the unique biological changes of midlife. I'm here to cut through the noise and bring you the practical, science-backed insights you deserve. Welcome to your best years. To understand if it's shrinking, we first have to agree on what it is. For decades, most women were taught that the clitoris is just that small, sensitive button or pearl located at the top of the vulva. If that is all you think the clitoris is, then yes, it might look like it's disappearing. But that visible part, the glans, is literally just the tip of the iceberg. Look at this. This is the full structure. It is massive. It is composed of erectile tissue and contains roughly 8,000 to 10,000 nerve endings, double that of the male glans. The glans. This is the external sensory center, the visible tip. The shaft, the body that goes back into the pelvis. The crura, the legs. These anchors flare out internally, running alongside the vaginal walls. The bulbs, these swell with blood during arousal, just like erectile tissue. Why does this matter? Because even if the external tip seems smaller or hidden, the engine, the powerful internal structure, is still there. We just need to find a better way to fuel it. Why does the tip become hard to locate or less responsive after menopause? There are two primary mechanisms driven by the loss of estrogen. Reason 1, true atrophy, the shrinking. Yes, the glans, the visible tip, can slightly decrease in size. Estrogen helps maintain the turgidity and blood flow to the erectile tissues. When estrogen drops significantly, this tissue receives less blood, causing some reduction in volume. This is called clitoral atrophy. The sensation result. Reduced blood flow means the erectile tissue doesn't engorge as easily during arousal. This translates to less overall sensation and makes achieving climax more difficult. Reason 2, phimosis. This is the most common and often missed problem. The clitoris has a protective layer of skin called the clitoral hood. The mechanism. Due to estrogen loss, the surrounding tissue, the labia minora, loses fat and elasticity, becoming thin and dry. This thin tissue can start to adhere or stick to the glans, slowly covering it up. This condition is called clitoral phimosis, or clitoral hood adhesion. The sensation result. The adhesion acts like a muffler or a shield. It prevents the sensory stimulation from reaching the nerve endings of the glans effectively. You might be touching the area, but you are just rubbing thin, adhered skin, which registers as low sensation, irritation, or pain, not pleasure. To reactivate this area, we need to bypass the muffler effect and overcome the reduced blood flow. Forget the techniques that worked in your 20s. We need 3 new rules. Rule 1, always lubricate. The friction shield. Why? Because the vulvar skin is thin, atrophy. Even if you aren't feeling dry initially, the rubbing of skin against skin will quickly cause microscopic tears and pain, instantly killing desire. The fix is use a high-quality silicone-based lubricant. Silicone does not absorb and provides a long-lasting glide that shields the delicate skin from friction. Apply liberally to the entire vulvar area, not just the entrance. Rule 2 is pressure is better than rubbing, the vibration bypass. Why? Because the glans is often hidden or muffled by the hood, low-frequency rubbing is ineffective. It irritates the surface without penetrating to the nerve center. The fix is use a vibrator. Vibration provides high-frequency, sustained stimulation that can penetrate the hood adhesion and reach the nerve endings. Pro tip, use a vibrator with an adjustable intensity. Start with indirect, lower intensity around the area to build blood flow, and then gradually increase the intensity using pressure rather than speed over the hidden area. Rule 3, focus on the internal legs, the inner pulse. Remember the crura, the legs that wrap internally? They are still highly sensitive. Stimulating the tissue surrounding the vagina and pubic bone can activate those deeper internal legs and create a broad, powerful sensation you haven't felt in years. During partnered or solo stimulation, use a firm pressure on the area just outside the labia, moving in a C shape toward the inner thighs. This targets the deep internal structure and can create a broad, powerful sensation you haven't felt in years. If you are certain your clitoris is covered, you can work to gently unstick the hood. This requires patience and consistency. Step 1, localized estrogen, the softener. The best way to fix adhesion is to restore the health of the tissue. Talk to your doctor about localized vaginal estrogen, cream, or insert. Estrogen thickens the skin, restores elasticity, and makes the tissue pliable again. This is the foundation of unsticking the hood. Step 2, gentle retraction, the daily practice. In the shower or while applying a thick moisturizer like coconut oil or Aquaphor after your shower, use a clean finger and gently try to pull back the hood. You're looking for a slight stretch or release. Do not pull hard. The goal is to slowly, gently stretch the adhered tissue over weeks and months, not hours. If you feel sharp pain, stop immediately. Step 3, hyperpigmentation and lumps. Don't be alarmed if the glans underneath is darker, hyperpigmented, or if you see a buildup of white material, smegma. This is normal when the area hasn't been properly exposed and cleansed. Gentle washing with water will resolve this as the hood releases. If the adhesion is severe or painful, do not try to fix it yourself. A gynecologist can perform a simple, quick, in-office procedure to gently separate the adhesion. Your clitoris is a resilient, powerful organ. It does not disappear. It is simply adapting to new hormonal rules by pulling back its shield. You have the power to bring it back into the game. It requires strategy, eliminating pain with lubrication, using vibration to bypass the muffling, and being patient with the retraction process. Your body is still wired for pleasure, and understanding this hidden anatomy is the first step to unlocking a more intense, fulfilling experience. I'm Dr. Emma. Thank you for watching. If you found this helpful, please subscribe and let's keep this conversation going.